Okay, we are live on the latest episode of Catalyst Talks. I'm Joseph Kopser from Grayline Group, joined by Dan Nardi of Reimagine Care. Dan, how are you this morning?
I'm doing great, thank you. How are you, Joseph?
I'm well. I'm in Austin, Texas today, and it's finally not going to be 100 degrees today on October the 2nd. You're in Chicago. So, what's the weather like in Chicago?
We're gonna hit mid 80s today, nice and sunny. So we got a fall hasn't quite arrived, but it's on its way.
Got it. Well, thanks for taking the time to be with me. As those viewers that have been a part of Catalyst Talks in the back nearly 70 episodes, what we focus on are people working on really novel ideas, bringing innovation into the space that they work on. And when I learned about Reimagine Care and what you all are doing, especially around the area of addressing the changing demographics of the U.S., which is a shameless plug, chapter 7 of our book Catalyst, from which the podcast is named, I knew that I had to talk to you. So describe for our viewers and listeners that are maybe watching it either live today or watching it taped later on, YouTube, LinkedIn, or Facebook, what is Reimagine Care and what do you all do that's different than others?
Yeah, I appreciate it. Well, first, thank you for having me. It's always great to have a conversation opportunity to share a little bit about what we do. And one of the most important kind of aspects of Reimagine Care is we're there to help patients as they're going through their cancer journey, as they're going through their cancer treatment. There's 4 different kind of areas that healthcare is delivered. It's either in the hospital, in the clinic, virtually now, or in the home. And what we do is we partner with organizations that are really great at the first 2. And we're able to be an extension of that cancer care and the cancer treatment into the home and the virtual settings. And so that's really a big focus of what we're doing. We've been at this now for a couple of years and have really had some great traction and excited to continue to build the business.
Yeah, so I read several of your press releases, some really phenomenal partnerships. In fact, I guess the last one or one of the biggest ones is with City of Hope. So, what does that look like in terms of the user experience or what your partners experience? I know a lot of what you're trying to do is to combat caregivers that are either professional caregivers or at-home family volunteers to, in many ways, give them a break or to shore them up. So, what does that experience look like for all involved?
Yeah, absolutely. So, one of the most important kind of aspects of just healthcare in general is, the vast majority of your healthcare journey is happening outside of those in-person settings in the clinics and the hospitals. And so, what happens when you're going through that, you're receiving treatment or just have some questions, like we're there to kind of help fill that gap. And we've all heard, recently the staffing shortages, the nursing shortages, doctor shortages, and it's only predicted to get worse. What we're able to do is be kind of that support for an already kind of taxed organization like City of Hope. They've got a lot of very talented people there. We want to be able to help kind of free up that work that they're doing for some of the triage, the inbound questions, that support, symptom management. We're able to be that and take that off of their plate so they can focus on the patients that are showing up in clinic and be there and be present for them and be operating atop of everyone's license.
And so as a non-medical professional myself, as we mentioned in the green room, my only experience with cancer this close personally was in the last stages of my mother's life, but she went straight into hospice. What you're talking about here is providing that quality of life to allow people to be at home longer, but still have the professional care. And I understand there's apps involved. There's also different ways to contact folks. So what is that user experience if you're a family member or the patient itself?
Yeah, absolutely. So our platform is based off technology. So we have a proactive chatbot, AI chatbot that is able to reach out, connect with patients on a regular schedule throughout the week and really kind of engage in those conversations so we can identify if patients are experiencing any symptoms, having any adverse effects to their treatment. And then that combined with our very talented oncology trained nurses and APPs are able to be there. So as those conversations are happening in the chats, if any of those kind of escalate up, or if we identify that someone might need a little additional support, we're able to, our team is able to take over those conversations in real time, kind of seamless experience. And then from there, we're able to, transition those into either a live phone call or a video visit to help further support that patient. So these are things that otherwise these patients might have, if they weren't able to get an answer, they're going to rely on Google or they're going to go back into the clinic. And, either one of those aren't exactly great patient experiences. And so we're able to deliver them, very appropriately timed responses and answers, and help support them through those journeys that otherwise they didn't really have that support of.
Right. And so, one of the things we talk about in Catalyst Talks is innovation. So, and this sounds like an innovative way to do it, but why was it not being done before? What were the things that you all have created, or the hurdles you've overcome, or maybe it's regulations that are changed? Why were we not doing this more before?
Well, I think a lot of it, prior to the pandemic, a lot of people, weren't embracing the ability to do telemedicine, the ability to have that support at home, just the care.
And was that, by the way, I don't mean to interrupt, but I'm
Yeah.
very curious when I hear that a lot. Is that from a regulatory standpoint? Was that just, well, that's the way we do it here, we've always done it in the office? Like, what was the roadblock there before COVID?
A little bit of both, to be quite honest, right? I think it's change management. You know about that, all your experience, right? Change management's hard to get people, not only the caregivers, like the doctors, nurses, hospital staff, and executives, get them on board with moving into a new opportunity like telehealth, right? We kind of had the pandemic force us into it, and we were able to do in weeks what would have otherwise taken maybe years worth of kind of innovation and kind of pulling people along. But I think also from the patient's experience too. And we were always kind of taught, especially growing up, right? You needed anything with your healthcare, you go and see your doctor in person, be there in the clinic. And so, just what we were all used to. So there's a bit of like kind of the change management on the people side of things, but there were regulations that changed as well. And the opportunity to provide the same level of care, the same amount of advice, able to give clinical prescribing, all this other stuff, to be able to be done over telemedicine visits. Previously, you kind of had to go in, have these diagnoses provided, and then get the medication and go on with your journey. So I think it was a little bit of all of the above that was really kind of forced this upon us in a good way. It really kind of just jump started what we're now. A lot of digital health companies are able to be building off that as a great springboard.
And you've been in healthcare for quite some time, 2 previous companies before Reimagine Care. And so you've seen these pivots, this innovation, these changes occur in the industry. But how much more change is necessary? I mean, we know that healthcare is a significant cost in our overall budget as a population, as far as the federal government. I mean, it's just massive opportunity. And so where do you see the future of Reimagine Care in terms of being a part of that long-term solution?
Yeah, well, that's a great question. I think to your point, healthcare in this country, it's not like completely dysfunctional, but we know it's broken. There's huge opportunities to be making an impact. And you just think about the percentage of our GDP we spend on healthcare in general, and just see the rate of increase year over year. It's obviously not working. And so there are a lot of talented people out there across the healthcare organization that are working on great solutions, great products, innovations, new payment models, all this. There's a lot of different people solving these problems, and they're all needed. I think what we need to continue to do is find these opportunities to just kind of overhaul the entire system, but it's not going to happen all at once, right? So that's what these organizations like Reimagine Care and others are doing. We're trying to tackle what we can control,
right?
And so in our case, when you ask like, what do we see this Reimagine Care having that opportunity to make a big impact? Well, right now we're doing the symptom management, really able to support those patients going through their treatment. We're actually looking to, and we're actively building out right now, the opportunity to move some of that treatment in the home. Right. So 97% of all adverse effects from chemotherapy are identified after the first 2 rounds that a patient receives. And so think about that. That's a really steep drop off. So, at that point, you're going to have an opportunity to potentially move, the next handful of rounds of your chemotherapy into the home. Like, that is a much better experience for the patient, and it frees up space in the clinic.
And are you talking about the actual application of the chemo treatment in the home?
Yes, that's what we're actively building out right now. And so we talk about, you mentioned this earlier, right? So the aging population, and we both read the Emperor of All Maladies, right? That cancer is brought upon as we all get older, and as the population lives longer, there's a higher incidence of people that are diagnosed with cancer. And so we're going to see this continued growth of people that are needing cancer care and cancer treatment. And we don't have, all the space in the world for these clinics and, and hospitals to continue to build out. So we have to find new ways to be able to move that care and that treatment into additional settings, virtually, home, et cetera. And that's where Reimagine Care is really well positioned.
Yeah, no, obviously I'm bullish on what you all are doing and optimistic for the changes it'll have, especially in the quality of life. Because I think so often, whether it be policymakers, business leaders, technologists, whomever, sometimes I believe focus a little bit too much on the extension of life rather than the improvement of life. And I know as I look at the literature and your website, you all are very much on the improving the quality of life. And can you speak kind of more to that about the underlying cause and reason for that?
Yeah, well, I think that's a really important distinction, and I like that you called it out. So I've got a great example here, right? So if we have a patient, we were hearing of newly diagnosed, had mother of newborn twins. She was newly diagnosed, and she's going to have to start going into the clinic now for her treatments. And so I think about 18 rounds of chemotherapy for breast cancer treatment. Wouldn't it be a really great opportunity? It's a great use case of like, why can't we bring the treatment to her, right? So otherwise she's having to, in some cases, bring her newborn twins into a hospital setting to get this treatment, not only the travel, the logistics, the components of it, but also bringing newborns into a place that, as clean as hospitals are, there's still opportunity for infections and everything else. And so why aren't we able to then bring that treatment to her? That's a great, just one example of a use case. And there's so many others that I think it applies for. And that's to your point about the quality of life. Like, we should be able to, as a society, identify like ways that we can take these treatments. They're effective. We know that we have effective treatments for a lot of types of cancer. And so why can't we take those and help improve someone's quality of life as they're having to experience it, instead of forcing them to always show up in the four walls of existing clinics and care space?
Yeah, no, I mean, everyone has had stories or examples kind of like what you just described there of the mother with the twins. But I'm very concerned long term as we become an aging population that we're going to be at this situation where we're going to have people living a really long time. And you can already speak to the impact on Medicaid. You can already, or Medicare, I should say, the impact on overall cost of healthcare, because it was a prior guest on Catalyst Talks who mentioned that in your entire life, of all the money ever spent on your healthcare costs, about 90% of it comes in the 10% at the beginning of your life and the 10% at the end of your life. And everything else in the middle is not so much, but it's in those two very expensive times. So I wonder how Reimagine Care is going to be able to be a part of reducing those overall costs while at the same time increasing quality of care. And what does that look like? Just because they're not going into the hospital, is that the most expensive kind of care? How does that impact?
That's a big part of it. And also, we're working on just overall the how is cancer care paid for, right? We've been talking traditionally about, or earlier in this conversation, about how it's delivered, but also how is it paid for, right? A traditional healthcare system, we all know, is kind of more of a fee-for-service type model. And there's been a lot of conversation around value-based care and how are we moving to more value-based care, payment arrangements and everything else. That's something we're also very actively working on. It's an important part, I think, in the future of all of healthcare, is we can't just keep paying for healthcare the way we have. And so how are we able to, as part of our mission and the ability to deliver this care, be able to do it in an effective way? I mean, part of it is, yes, moving it out of the in-person setting. It's proven that you can deliver care much more cost effectively in virtual and at home, but also like it's the broader, like, how do we pay for it? What are those arrangements? We have to pull together the right organizations to be able to make these changes. We talked about the treatment delivery in the home. It's not just Reimagine Care. There's a lot of really important parts that kind of go into it. It's the same thing with the payment side of it.
Yep.
You need to have the health systems on board, the payers on board. What does that all look like? And so I think we just really need to make sure we got the right people at the table to make that like long-term impact.
Well, I can't let you get away without asking your opinion, not necessarily that of your company or of anybody else you might represent, but your opinion on how do we as a country talk more smartly, perhaps informed, if you will, about the long-term costs of healthcare and who pays. Because on one hand, there's people that want to make sure that it's all paid for by the government. Then there's another group that says, yeah, but that means it's all the taxpayer. And then in the middle is the tragedy of the commons in terms of, well, there are some people that still need care that aren't getting it, and those that can't afford it don't need it as much. So how do we get this tackle this problem? Because that's a larger innovation in healthcare that's still out there looming.
Yeah, and in my personal opinion, since we're clarifying, the healthcare has some very large players, and some organizations that have been very successful at making money and returning shareholders' values, and that's all fine and good. It's free market economy. Now, I think what we need is those big players to really be coming together and kind of just drop all of the it's their fault, finger pointing and everything else. I mean, we really need the insurance companies, the payers. We need the health systems coming together. We need the PBMs. Like, if you get those three types of organizations together and just like have everyone drop all of the guards that we put up and protecting our silos and our revenue streams, and really be like, all right, this is broken.
Yep.
How are we going to fix it? I think if you get to larger organizations, because smaller organizations like Reimagine Care, we get this in the startup space I've been in now, being able to help grow companies over the last 10 years, companies like that, we get it, but we're still small fish, right, in this big pond. And so how do we get the big players on board, people have an open conversation instead of the finger pointing, be like, we got to solve this. Like, there's a bunch of talented people at all these organizations. We just need people to kind of stop protecting their own turf.
Well, you're definitely charging my batteries, because that's why I love conversations like this, because it restores hope for me and others, I'm sure, that there are people like you who are passionate about it, smart about it, and are trying to solve the long-term problem. So let's pivot now and go back more to Reimagine Care and just describe. So if someone's watching this later on, they pick it up on YouTube later on, or it's recommended by a friend, they grab the link and they're hearing this conversation, they're like, aha, this makes sense. Beyond going just to your website,
Yep.
help us understand, the audience, what kind of partners are you looking for? Who's the ideal type or group or location? Because while you're growing, there's still a much greater demand out there in the US in terms of cancer care. What does that look like? Who are future partners? What's the ideal situation look like?
Yeah, that's a really great question. So I'll kind of split it up into maybe two different categories, right? So we're going to have organizations like the City Hope of the world, Memorial Hermann, CCBD in Dallas, organizations like that. So whether they be large AMCs, health systems, community physician organizations, anyone that is basically providing cancer care, cancer treatment for a population, that's really like our initial target. We can help support any one of those organizations, and we're able to be that extension in, like we talked about earlier, into the virtual and into the home. And so I think that's one from a more of a client partnership. On a partnership, like how do we pull this off? How are we successful kind of all together? We've popped up on the screen there a minute ago. We got really great partnerships with Dispatch Health for that kind of last mile, showing up, boots on the ground type organizations. Really, it's a big part of our delivery, right? So obviously we're trying to make sure we're providing as much of the care in the home, but sometimes someone does need someone to come to them. Otherwise they would have to go into the clinic. So Dispatch Health is a great partner of ours. Memora, which is kind of the part of our tech platform, kind of behind the scenes, that proactive AI chatbot. So there's partnerships like that really help this scale. I mean, as the size of company we're at, the stage of company we're at, we can't do all of this on our own, right? So you have those really important, as you're talking, those important conversations. And do we build, do we buy, do we partner? So organizations like Dispatch and Memorial are huge with that as we're continuing to grow. And then maybe even a third bucket is, Cancer X, the Moonshot program that's being really run out of the White House, in combination with a couple other organizations like that. That's a way where we got a lot of focus on trying to solve big problems in healthcare. So it's an organization that we're really proud of to be one of the founding members and really support, with our expertise and in any way that we can. So those are kind of some of you talk about partnerships, kind of put in those couple different buckets, if that makes sense.
Yeah, no, it makes perfect sense. So let's stay on the subject of what is ideal. And you described those partnerships and the three different ways to look at it. But let's talk about team members, though, because I know that you have a wide range of folks to include, as I understand it, some RNs and some practitioners. Again, not knowing the language of the business, but you have medical professionals on your team in addition to general technology and general business folks. So if someone learns about this company, whether it be personally because of an impact that cancer's had in their own life, and they want to be a part of the solution, what type of teammates do you have today? And then do you anticipate in the future?
Yeah, that's a really great question. So I'm going to take it super general at the moment. I'll get into a couple of the maybe more specific roles. But, if you're someone that has that entrepreneurial spirit, really has that interest in solving big problems, and really kind of doing it as part of a team that's fast moving. Like that's what we're looking for. You and I talked about in the green room, saying just some of the culture stuff. I really enjoy that opportunity as we're building a company.
You mean folks that cross their arms and say, no, this is the way we've done it and we'll always do it. They're not ideal for Reimagine Care?
Probably not a best fit. No. And we talk about, as our hiring managers, one of the most important things, we're not looking for cultural fit. We're looking for cultural additions, right? Because as you continue to grow and hire, if we're always like hiring, recruiting for, asking questions for, or talking about candidates as a cultural fit, then we're going to be stagnant in our culture. And we have to be able to grow and evolve as the company grows and evolves, as a market, our clients, patients. So really trying to focus on, all of us at Reimagine Care, focusing on with any new hires, are we bringing in people that are cultural additions? So, it's really building that the team, that community within the company. We got the opportunity to talk a bit earlier. Like, I enjoy this stage of a business. It's really, really fun for me. And I think if you can find those right people that also enjoy this stage, we'd be bored out of our mind at like a 5,000 person company, right? But then again, if you were to take someone that works in one of those companies that may be super happy and successful and doing a great job, and you bring them into the craziness that is a startup or growth stage company, they pull their hair out, right? They'd end up like you and me. So, I think it's important to find that right role for the right person at the right time and kind of use that framework. But as far as the team specifically, we have a very talented group of oncology trained nurses, RNs. We have APPs, and even
what's an APP for my
advanced practice provider. So
okay, that's what I was saying.
It's like a nurse practitioner, and specifically focusing again, in all of them are trained in oncology, which is obviously the core of what we do. And we have a very talented medical director, Dr. Mehta, and it's really, this is an organization where you have to have a clinical focus. We can't just do this as a, if you think 5-10 years ago, technology startup out of the Bay Area, that type of stuff. You can't do what we're doing if you don't have that clinical expertise. And I think that's really important as we continue to grow.
Yeah, no, I mean, that's what kind of drew me to you all. It's a unique combination of startup, but also healthcare professionals that have been there, done that. Interesting blend. Okay, so because you have partnerships all over the United States, is your team all over the United States? Or are you kind of I suspect maybe part of this growing trend of companies that are dispersed in everyday life?
Sorry, I was reading a comment on the side that popped up. So I was trying to multitask there. Joseph, can you please?
Yeah, no. I was just asking, so as your partnerships are spread across the United States, is your company spread across the United States? And what does the footprint look like? Because you are, working with folks in some cases on site, or is it your partners that do that? What does that look like?
Yeah, we are all virtual, all remote. So the entire company right now is spread across the country. We have people, I believe, now in all time zones, which is exciting and it's great. So, but it is different. When you think about building businesses, before you kind of all have a central home, a hub, and you kind of go in the office, and even the pandemic, people now, as we're coming out of that, companies are trying to bring people back into the office a bit more. It's great to have that connection. So what we're doing, we're having to kind of recreate that in a virtual world and build that culture to keep us all kind of strong and together and really kind of doing this together and energizing each other day in and day out. But we are all remote. And we found is, again, going back to the right person, right role, right time, because we're building this company from that way, like right from the beginning. I think we're able to identify the people that are right fit for us. Because some people, it's not, that they don't enjoy as much being remote. They need to be in person, and that's okay too. So,
and are there parts of the country, we often hear about the medical center in Houston or the growing ecosystem in Nashville that's doing quite a bit in healthcare. Are there parts of the country that are better or leaning forward that other cities or other regions can emulate?
As far as like a healthcare delivery, or more like the health tech startup, or just
all the above? There's probably different answers for different places.
I think the important part is that there are talented clinicians and care delivery organizations around the country, right? And that was something that I really, with my last company, Carum Health, we were able to identify those kind of top 10% of surgeons, and eventually got into oncologists as well around the country based on actual data, right? This isn't something where you can go kind of Google like, all right, who's the best knee surgeon? I need my knee replaced, right? You can't really find that data based on outcomes. You get some patient reviews and different sites that do that, and that's great. but actually like based on data, like we know that there are talented people all over the country. So I think that's number one, is really kind of, how do we collectively identify who those are in all those organizations? And as far as like, yeah, Nashville, definitely booming city in the digital health space, health tech. I mean, obviously a lot of health systems were kind of started out of there and have grown out of there, but really great health tech kind of startup space. A lot of VCs now, and a lot of people kind of moving out of the Bay Area and New York and others into Nashville. Chicago's another one. I've been here in Chicago now 16 years. We've got great organizations like Matter, 1871, other kind of incubators and startup spaces to help people that are, focused on solving big challenging problems in healthcare. So those are two. I know there are plenty of other ones, Columbus, Ohio, and down in Houston and others. So there are definitely others out there. Those are a couple that just kind of come to mind from my experience.
Yeah, and I think it's important to note for viewers, especially those that are interested in healthcare innovation like you all are doing, that you pointed out that not only are there hubs of excellence across the country, but your company, for instance, happens to be all virtual at the moment, which allows them to be able to participate maybe anywhere that they might be. But there's one other question, or one other area I think is different about oncology and cancer treatment. And we alluded to this a little bit in the green room, but I'd love to expand on it, especially for those of us that are about my age in their 50s who are now starting to have to care for, hopefully their kids are growing up, but if not, they're caring for kids at the same time they're caring for parents, and it's making us the sandwich generation.
Yeah.
How different is oncology treatment than, say, a primary care manager, where it's the center and the hub and spoke, or in the case of oncology, it's all inclusive? What is the distinction there that viewers need to understand?
Yeah, I'm glad you brought that up again. Thank you. So traditionally, for you and I, for instance, or even for our kids as they were growing up, like, you've got the PCP and you kind of go to them. That's that hub, right? And anytime you need specialty care, could be allergies, could be this, could be dermatology, whatever it might be. As we get a little bit older, it could be your specialist for a knee replacement, shoulder replacement, those types of things, right? But it all comes back to PCP as kind of being that hub, right? The primary care provider. In oncology, it's a little bit different in the fact that, once someone is diagnosed with oncology, you're transitioned over to an oncologist, and they kind of become the PCP, because all of the care really revolves around the oncology, right? And the treatment of it. And so it's a bit of a different model. So instead of, PCP is kind of like referring out and getting back. And I'm talking about patients, data streams, revenue, all that other stuff. But oncology is a bit different. And so, really kind of, again, making sure from a patient perspective, whether it's something you're going through or whether it's someone that you know and love and care for, is really understanding that relationship with the oncologist, and how do they kind of be that new nucleus for your care treatment moving forward.
Yeah. Huge to think about, and a lot of moving issues. And the fact that you all are on the cutting edge of it makes me feel a little better, especially as people continue to age, and as a population, we continue to age more so than any other generation before. So we're almost here at 30 minutes. I told you it was going to go fast. What did I not ask you that you want to make sure that viewers take away or go do their own homework on and learn more about what you all are doing?
Yeah, I don't know that's a question, but I'll go back to a point we made earlier, is like, there are so many opportunities to make an impact in the US healthcare system. Some of them are obvious and they're big, challenging problems. Some of them might not be so obvious, right? But at the end of the day, we need people that are passionate about solving these problems. We need talented people that want to work together as a team to pull this off. And so I think it's just really, yeah, I can't encourage young people enough. If you've got an interest in making a big, challenging impact on a part of our lives, a part of our kind of country, there's a lot of great things you can get into. But I think healthcare is one that I've been very lucky that I kind of ended up in this, right out of grad school, and I've been here now doing this for over 23 years. I've really appreciated the impact that the companies I work for and work with are able to have. So I just try to encourage talented people to get in here and make a difference, because there's so much opportunity to really improve our care delivery. We're all patients at the end of the day, right? We certain points in our lives, we may not need it a whole lot. I haven't had a physical in a couple of years, and I'm probably going to get in trouble for saying that out loud now, but we will all be consumers of the healthcare system. And so it behooves us and our family and our loved ones to really jump in and make a difference.
Well, Dan, what a perfect way to end that. Big problems need talented people with passion. And I'm glad that Reimagine Care is there, that you're there with your team. And while I never wish that anyone ever needed to go through cancer treatment, the reality is that many people will. And I'm just glad to know that Reimagine Care is there to be a partner. So thank you very much for being on Catalyst Talks. I look forward to keeping up with you and your continued success in the future.
I appreciate everything, Joseph. Thank you so much. Have a great
You
day.
too. Take care.
Bye now.